Welcome to today's vendor spotlight. Today we have Hollye Rider from Primary Care Diagnostics. Hollye, welcome today.
Hey, good to see you, Deanna. Thank you for having us.
Of course. Well, first, I wanted to find out a little bit about you. Can you tell us maybe a little bit about your background and how you got started in this industry?
Sure. I sold pharmaceuticals for about 14 years, and then I did some consulting for a couple of physicians after that, and then I bought half of Primary Care Diagnostics and have been doing this for 24 years now with my business partner, Tim Shelton. He was the original owner, and I bought half the company in 2001. So we've been together now for 24 years, and we sort of handpick the best products that we feel we can offer our clients and that have a good patient care, good return on investment, and very easy to maintain, if you will, with low, low disposable costs, things like that.
Great. Well, and what made you, I know you said you were doing a little consulting, but what made you decide to, go all in and partner, 25 years ago or 24 years ago? What made you decide to do that?
Yeah, so I was giving Tim leads at that time. All we had at that time was a 24-hour Holter system, and I was giving him leads, and I went on a few calls with him, and I was like, I really like sales, come from that background, and consulting was exciting, but it wasn't really what I wanted to do. And so I decided we both agreed on a price and bought into the company and never looked back. We just started expanding our product line and our offerings, and we've got a spirometer that we sell that we have private labeled for us out of a company in Finland. We sell EKGs. Our main products right now are the TM Flow system that some of your clients will be interested in. We have a vestibular system, and then we just recently signed an agreement to distribute the cognition for dementia and concussions and Alzheimer's.
Wow, that's awesome. Well, I definitely want to find out a little bit more. I know that you kind of hit on a couple of the products. Can you tell us a little bit more about the TM Flow and maybe why people are purchasing that? What's the use case for it, and how are practices, getting a return on that?
Sure. The TM Flow, in our 24 years, this is the best product we feel like we've ever sold. We've been selling, we sold an autonomic nervous system test years ago. So the CPT code is nothing new to the medical community. We've also sold ABI, ankle brachial index, over the years with different ways of getting those measurements. But the TM Flow puts it all together in such a seamless way that it's easy for offices to use. It's all Bluetooth. It can download up into the patient's electronic health records, their EHR. It takes about 7 to 10 minutes to do. The only cost per test are the electrodes. So you got only $2.59 or, about that in the disposable cost. And as far as patient care, this is just a great device because, for example, some of your practices, I understand, are doing neuropathy treatment.
Yes.
So up until now, they would have to do several different tests to find out if that patient has peripheral neuropathy. But with the TM Flow, if someone presents with numbness, pain, tingling in their feet, say they're diabetic even, your mind just automatically goes, as a provider, goes to diabetic peripheral neuropathy. But that's not always the case. So the first 2 minutes of the TM Flow does a pseudomotor test to test for small fiber neuropathy. And then it goes into the ABI. And the ABI in itself, I always like to sell it to people that are used to doing ABIs because they just think this is the greatest way ever because it's fully automated. The cuffs are Bluetooth. They automatically inflate and they automatically calculate the ankle brachial index. So within the first 4 minutes of the test, it gives the provider an idea if it's neuropathic pain or if it's from a blockage. And then the autonomic nervous system is just icing on the cake. We basically are testing for what's called cardiovascular autonomic neuropathy. And that's where the patient's nerves that innervate their heart are damaged, just like the ones that innervate their feet. So they don't feel pain, chest pain like you and I would. They don't have flight or fight, not to get too in depth, but their parasympathetic and their sympathetic nervous system are all out of balance. So these people can sort of be ticking time bombs. So you want to make sure that you get them the appropriate care from a cardiologist if you identify that in these patients. So it's just a great, you bill 3 CPT codes. The average reimbursement across the country is about $260 and takes about 10 minutes to do the test.
Wow. Okay. So it sounds like it's able to just really help the practices, in time. Also more in depth of a reading where maybe we could have potentially missed something because we're maybe focused on, it's diabetic neuropathy. They have something specific, but this seems to be something that is helping a lot of offices. Can you tell us a little bit about what that looks like? So let's say I'm a provider. I'm looking to get the TM flow. What can I expect in working with Primary Care Diagnostics that would set you apart from other people that might be doing the same thing as you?
Okay, good question. Yeah, we try to get this out to clients because we are not the only person selling this equipment. We do not have an exclusive, but yet we're the number one distributor, and there's a reason for that. We start from the very first. All the equipment comes to us. We make sure everything is set up perfectly before it leaves our facility. And the cuffs, everything are paired and ready to go when it's received. As soon as it's received, they let us know. We send them a cart with an electrical supply built in. A lot of people don't do that. We put extra information on our desktop of our laptops before they go out. Patient survey forms that help identify the patients, billing forms that give them some suggested ICD-10s and CPTs. Now, we're not billers. We don't profess to be, and we have a big disclaimer saying that we're not, but we just know, what we've heard from people over the years, and they can always Google the ICD-10 codes for those CPT codes too. But we do a lot of hand holding. We do a Zoom call training that is we've got it down to a science. And then we will actually have another call with the providers to go over some example reports with them. If they want us to talk with any of their staff, we'll be happy to do that. The main thing is we answer our phone when it rings. There's some people that buy this from someone else and they'll say after they sold it, they won't even answer our phone calls. We are constantly, helping people. I put on my emails, call night or day if you have any questions. I think you experienced that. I was on vacation when you and I first talked, when you sent in your inquiry, and I called you back within like 10 minutes and I was on vacation. So we try to really take care of our customers. We know that they could have a patient there in the office, and when they need us, they need us. So we do first line troubleshooting with them. We can log in their computers and do a lot of frontline without even having to call in for manufacturer tech support. We try to do a lot of that ourselves.
Wow. Okay. So that sounds like you guys kind of have like a all hands on deck with the team, the provider, and obviously follow up. And I will acknowledge that, yes, while you're on vacation, you did not just send me one email follow up. We actually communicated multiple times. And so I'm like, is she on vacation? Because she's still working here. But I'm glad that obviously we connected, and it's very important. Obviously, a lot of our clients are looking for different tools. And one of the things that we also hear is that, hey, they don't have the support part. So it sounds like you guys have the support. You have the product actually come to you. So you guys make sure that everything's good before it goes to the provider. And then once you have that, we have the Zoom call, we have the training. And then you're saying that email calls, we could do that at any time.
Right. So, and we also, offer financing. We have third-party financing with companies that we've worked with for years. So that's a big plus. And we stock the supplies as well. Some people have trouble getting the supplies, but we stock them and we make sure that we keep them supplied with those.
Awesome. So then would people reach out to you to get those types of items?
There's an order form on the laptop when we send it out. There's an order form, and most people just fill that out and email it in, or they'll just text me and say, "Hey, Hollye, this is so and so at ABC Practice, and we need some TM Flow electrodes," and they go out that day.
Okay.
And we'll build them. We'll build them net 15.
Okay.
Yeah.
Okay, great. And you also mentioned when you were talking about some of the products that you offer, could you kind of give us a little bit of more insight on, I think it was, you called it cognition, or it was for the dementia or Alzheimer's?
Yes. This is a brain mapping test that can be done in primary care setting, if you will. It's for patients. I thought concussions, when I think of concussions, I think of football players, right? Or boxers, but it's a big deal. Concussions are a big deal out there with elderly patients falling. A lot of times diabetics can't feel their feet and they fall a lot. And a lot of times I'm still learning about this product, but a lot of times it does not show up on a CT scan, and it will show up in evoked related potentials. And that's what we're measuring. So probably everyone listening to this knows about a stress treadmill. So you exercise the patient on a treadmill, and then you get a baseline EKG. Then you stress them on a treadmill and you see what happens to their heart. Same thing with this. We do a audiometer test. We test their hearing. Then we do a baseline EEG to look at the brain waves and responses. And then we stimulate the brain with certain signals that the patient listens to. And the whole time they have these little sponge electrodes on their head. So they push a button and we measure how quickly they push the button and then how quick their brain responds to that stimuli. So there's complicated numbers and graphs that the report that's generated is fairly easy to understand. And we do have neurologists that will overread these tests as well. But the reimbursement is really good for this test, and it's something that's needed out there in the primary care market.
Awesome. Great. I know that there's a lot of things that you offer, but what are some common mistakes that people are dealing with when they're kind of looking and searching for some of these products out there? Do you have any advice for people that, if we are looking for something, what would be the best tips for me to identify going with a product or not?
I think you probably need to look at your patients, your demographics of your patients. For example, with the TM Flow, we sort of have a HUDA test. And say if you've got the HUDA test is anybody you suspect has peripheral arterial disease, any diabetic type 2, say 50 years or older, and any Medicare age patient that has high cholesterol, hypertension, diabetes, and smoker. So you sort of comb your charts, if you will. And that's why I think that the patient survey comes in handy. You can start giving the patient survey out to your patients upon check-in and see how many of them would qualify for the testing. And that sort of helps you identify those patients before you spend the money. Then I think you also need to really pay attention to the person that you're buying it from. Because like I said, there are a lot of people that sell equipment, but that's all they do. They don't really consult their clients. They just move from one sale to the next. We're all about building a relationship and getting referrals. That's how we get a lot of our business, because somebody's pleased. We've got some clinics that have multiple offices and they may buy one TM Flow and then another and another and another. And that tells me several things. Number one, they're pleased with the patient care they're getting from the TM Flow. They're making money with it, and they're pleased with us, or they would not keep coming back and buying it from us.
Right. Well, okay. So what would you say is the most rewarding part of what you do?
I think building the relationships, people, I mean, we're in 34 states with this piece of equipment, and there are people that I haven't even met, but we've built a relationship with them. And, I know that their husband's in the hospital, and I know that they just had a baby or they just had a grandbaby or whatever. And then the fact that they are being successful with the equipment too in their office, that it is filling a niche for them, whether it be patient care or revenue generation. I think the worst thing that people think is it's a bad notion for doctors to make money. Well, it's a business just like anything else. And you can't just make a living seeing office visits.
Right.
And sort of our philosophy has been, you can either work harder and longer, or you can work smarter. And so the only way to take it to the next level is to increase your hours, add to staff, and work yourself to death trying to see more patients. Or you can do more, you can offer more ancillaries to the patients that you're already seeing.
Beautiful. That's it. That's the key here. So, well, Hollye, I greatly appreciate the time, letting us know what you do about primary care diagnostic, and then also just the tools that you have available for these providers. If somebody wanted to get in contact, what would be the best way to get in contact with you?
Email or text or phone call. And I think you have our numbers. I can give it to you now if you want me to say it out loud, but it's on our website. And we try to answer our phone when it rings. And like I said, we've been in business for a long time, and we would go on vacation and my kids would say, "Mom, you're always on your phone." And I'm like, when my phone rings, I answer it, because somebody may need to buy something on the other end, basically. Perfect. So, so if they want to just reach out, I'm sure you have our contact information that you'll post somewhere, and just reach out to us. We won't bug you to death. We'll answer your questions. We prefer the first call to be a phone call and not just say, "Hey, tell me all about your product," via an email. We'd like to get to know people and talk with them and find out what their needs are and see how we can best meet them and what works best for them.
Perfect. Okay, you heard it here. Hollye is by the phone, ready for you guys. She wants to build a relationship. So if you have a question, obviously we'll go ahead and drop her information down in the description, so that way you guys can get in contact. And of course, thank you so much, Hollye. I appreciate everything today.
Thank you, Deanna. I look forward to working with your clients. I've really enjoyed getting to know you and Natasha.
Well, thank you. I appreciate that. Thanks so much.
Alrighty. Bye-bye.
Bye.